All right, I'll go ahead and get started. Welcome, everyone. My name is Alessa Holler, and I'm a program analyst at Healthcare Ready. We greatly appreciate your participation in Dr. Annelle Primm's discussion on the impact of racism on mental health and well-being of healthcare workers, the fifth event of a series under the Restoring the Healthcare Workforce for Equity program. We want to make sure this is valuable for you, so this is how we plan to spend the next hour. After a brief opening remarks, we'll dive right into the webinar, followed by a Q&A session. A couple of housekeeping items before we begin. We'll be continuously looking at the chat, so feel free to post any questions or comments throughout our time together. If you'd like to make a verbal remark, please raise your hand so we know to call on you. The more you post in the chat and contribute to discussions today, the more beneficial we feel this conversation will be for you all. It will also help us to adjust and deliver recommendations that are most applicable to your experiences in healthcare settings. I'll now hand it over to my colleague, Angie M., Healthcare Ready's Associate Director of Programs and Policy.
Hi, and thanks, Alessa. For those of you who we hadn't had a chance to meet yet, I'm going to take a moment to briefly introduce Healthcare Ready and our work in health preparedness and response. Healthcare Ready is a nonprofit 501c3. We were founded in the wake of Hurricane Katrina when there was a recognition that there needed to be better collaboration happening between public sector and private sector to make sure that patients continued to have access to healthcare services and medication. So we exist to help organizations, governments, private sector businesses to make sure that they have the tools and the preparedness knowledge to be prepared to respond to disasters. Today, we serve as a linkage point, ensuring necessary discussions are happening between government, businesses, and response entities across health and public health. And we want you to know that we're available to support you and your organization in preparing for and responding to disasters. So if you ever need us, feel free to reach out to our team at alerts@healthcareready.org. That email will be dropped in the chat. We're available to answer questions and support. As my colleague Alessa mentioned, today's discussion is brought to you through our program on restoring the healthcare workforce for equity. It's funded by the Center for Disaster Philanthropy, and it's one of a few initiatives that we have here at Healthcare Ready that are specifically geared towards capacity building for healthcare centers and clinic staff. There's a few goals that we have around the program. It's a time-limited program that's a year long, but primarily we want you to know that we have a few webinars and trainings available for you to learn from. They're posted on our website. We're also producing a few research reports around healthcare workforce challenges, what health centers and clinics have experienced through COVID-19, and what organizations can be doing to support their teams and what policymakers can be doing to support a better environment as we navigate the recovery from COVID-19. This program and the webinars seek to highlight the challenges that the healthcare workforce specifically has experienced throughout the COVID-19 pandemic in our current phase of navigating recovery, whatever that looks like for your organization, in your household, and in your lives and communities. The research and the webinars being conducted through this program have a really special emphasis, though, on providing support and resources for communities that have been hard hit by COVID-19. What we mean by that is communities that have experienced disproportionate impacts from COVID-19. Those are Black and Indigenous communities, people of color, members of healthcare who are from communities of color themselves, and all frontline workers that serve patients in health centers and clinics across the country every day. So we hope you'll continue to stay connected and join us for our future webinars and findings. Our next webinar will be focused on mental health and resilience for California healthcare center staff. Email us if you're interested in joining. And with that, I am pleased to kick it off to our speaker today, Dr. Annelle Primm, who joins us from the All Healers Mental Health Alliance. Dr. Primm, please take it away.
Thank you so much, Angie. I appreciate the introduction, and it's been such a pleasure to work with you and your team at Healthcare Ready on today's presentation and the one back in August. I'll just introduce myself. I'm Dr. Annelle Primm. I'm a community psychiatrist based in Baltimore, Maryland, and I serve as the chair and convener of the All Healers Mental Health Alliance, which is a multidisciplinary group that has been together since Hurricane Katrina in 2005. And what we do is facilitate culturally grounded responses to the mental health needs of Black and other marginalized communities that are affected by both natural and human-caused disasters. And as you can imagine, that has kept us busy over the last 18 years, and certainly COVID was one of those disasters that we were engaged in responding to. So it's a pleasure to be with you today and to talk about this very important topic of the impact of racism on mental health and well-being in the healthcare workforce. And for some reason, my cursor, there we go. Okay. I think I got a little too heavy-handed there. So I'd just like to provide, just share with you the learning objectives, which include defining mental health and well-being, discussing racism and structural racism, and I will also address the topic of implicit bias or unconscious bias. I think one of our attendees requested that, and identify at least 2 examples of how racism contributes to burnout in healthcare workers, and name at least 3 strategies for responding to racism in healthcare settings. And just an overview, I will cover mental health and well-being and really all aspects of racism and how it affects society and in particular healthcare settings, and to draw connections between burnout, moral injury, and manifestations of racism in the healthcare workplace, and share with you a couple of case vignettes, and also how racism can be addressed on individual and institutional levels in healthcare settings. Before I get started, though, we have a couple of poll questions for you. I would love to have your engagement in those. I think we have 100% agreement there. We'll give people a little more time. Okay, so we can move on to the next question. So what part of the country are you from? Get a sense of the regions that attendees are hailing from. I see so far we have heaviest participation from the South. Okay, and we have a second question on this panel. How has racism shown up in your work setting? Okay, that's an interesting split between institutional, interpersonal, and none at all. Okay, very interesting. So thank you all for participating in our polls, and we'll have a post question for you with one of the questions. So I will go ahead and begin by focusing on mental health, which is a term that we use in our common language. And I'm not sure how many people stop to think about what mental health actually is. It's been described as effective functioning in daily activities that result in productivity in whatever setting you might find yourself in, at work, at school, and caregiving, and in our communities. The ability to form and maintain healthy relationships, and most importantly to me, the ability to adapt to change and cope with stress. Those are universal human experiences and inevitable, and hopefully leading to growth. Well-being, in contrast, as defined by the Centers for Disease Control, is the presence of positive emotions and moods, such as contentment or happiness, the absence of negative emotions like depression or anxiety, and overall satisfaction with life, a sense of fulfillment and positive functioning. And hopefully we are experiencing both of those at this time. But there are some things, factors, forces that can interfere with our mental health and well-being. And I would say that racism is one of them. In fact, it's been defined by the Centers for Disease Control as a public health crisis. This was in 2021, although racism has been that public health crisis even predating that date. Racism is defined as a pervasive system of power based on the social construction of race. And some people think that race is biological, but indeed it is a social construction. This is based on the notion that non-Hispanic whites are superior and people of color, such as people of Indigenous, Latin, Black, and Asian American descent, are inherently inferior. And we see throughout our nation and really across the world that racism operates across a number of levels, whether inside of us, interpersonally, in our interactions and relationships, and even at the institutional and systemic level, which results in the unjust advantaging of whites and the unjust disadvantaging of people of color. And in the words of the scholar and researcher, Dr. Kamara Phyllis Jones, she says that racism saps the strength of our entire society through the waste of human resources. And I think we need to look at racism through that lens more and more, about the waste that it causes and the damage that it causes. Structural racism has been identified as the fundamental cause of racial health inequities. And also, it is a critical social determinant of long-lasting, widespread racial disparities in population health that we see across this nation. And some people believe that, and I do as well, that structural racism is really baked in to American society, which has established and maintained a racial hierarchy of sorts. And this results in the differential distribution of goods, services, opportunities, and the protections of society that as Americans we all expect. But this is driven by race, which results in pervasive inequalities and health inequities across the life course. And structural racism, it shows up in many ways through what are referred to as inequitable systems of housing, education, employment, earnings, benefits, credit, media, healthcare, criminal justice, just throughout our society. And these systems then just underscore and entrench discriminatory beliefs, values, distribution of resources. And this is reflected throughout history, through our culture, and through interconnected institutions. You might wonder, what is the impact of racism on mental health? Well, we know through numbers of studies that systemic racism and discrimination can have negative consequences for both physical and mental health, as well as other social determinants. And one study that was done by UCLA found that young adults who experience frequent interpersonal discrimination based on race, sex, or physical appearance are at greater risk of mental health concerns compared to their counterparts who don't have these experiences. 25% more likely to experience psychological distress, the actual diagnosis of a mental illness, or to report excessive substance use. And as we mentioned earlier, the COVID-19 pandemic, this was an unprecedented disaster of massive proportions. It had a disproportionate impact on many marginalized communities, resulting in disparities in the extent of illness, death, loss, grief, as well as significant educational and economic fallout. And if you think about it, the impact of COVID-19 was superimposed on hundreds of years of inequities that have occurred in these communities. And also, it occurred in the context of contemporary challenges such as climate disasters, racial polarization, mass violence, and the senseless police killings of unarmed people of color, which we've seen a succession of in recent years. So what about the mental health of the healthcare workforce in COVID-19? We know that COVID-19 hit the healthcare workforce particularly hard. Members of that workforce were on the front lines from the beginning, and it took a heavy toll. A Mental Health America survey conducted from June to September of 2020 found that the healthcare workforce was stressed out and stretched too thin, experiencing high levels of stress, anxiety, frustration, exhaustion, and burnout, and just simply being overwhelmed by all that was going on. There were worries about exposing their loved ones to COVID-19. They were just exhausted from the long hours of work, not getting sufficient emotional support, and it even filtered into the parenting of healthcare workers. Just these strains made it even harder to support their children, who were also going through changes such as virtual learning as a result of the pandemic. The Surgeon General issued an advisory on workplace mental health in 2021. A survey found that 76% of US workers reported at least one symptom of a mental health condition, and this represented a 17% increase in 2 years. And I'd just like to underscore here what some of the essentials are for workplace mental health and well-being if we want to be deliberate about maximizing mental health in the workplace. Protection from harm with physical and psychological safety, as well as diversity, equity, inclusion, and accessibility. Connection and community are very important to foster inclusion, belonging, collaboration, and teamwork. Work-life harmony is also important, ensuring that people have some level of autonomy in the work that they do, some flexibility, and also respect for work-life balance. And then mattering at work. where people are valued for what they do, and they receive a living wage, that they have some contribution to decision making, that gratitude is expressed for the work that they do, the contributions that they make, and that they are recognized for what they do that deserves praise. And then opportunities for growth, to be able to develop through training, education, mentoring, and clear pathways for advancement. And just think a moment, to what extent does your workplace exhibit some of these 5 essentials? The Surgeon General's advisory, another one, was issued on addressing healthcare worker burnout, specifically recognizing that subset of the U.S. workforce deals with some extra added stressors. And among the recommendations were to empower healthcare workers and be responsive to their voices and needs, remove punitive policies for people seeking mental health or substance use disorder services, protecting health, safety, and well-being of all health workers, reducing administrative burdens so that more quality time can be spent with patients, with communities, and with colleagues, and also really centering social connection and community as a core value in the healthcare system, and investing in public health and our public health workforce. Well, I'd like to now enter racism into this equation and how it has been identified as a contributor to burnout, resulting in emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment, among other feelings that attend to that. And I'd like to point to a recent survey led by the Association of Black Psychologists. This was a survey of Black mental health professionals, including psychologists, social workers, and psychiatrists, which found that 28% considered leaving the mental health field altogether as a result of burnout, the lack of financial compensation, heavier workloads, and this was certainly true during the COVID-19 pandemic. And with the backdrop of racial polarization and violence, this led to a much greater demand on Black mental health professionals. And so they were, in many cases, paid less in order to accommodate people who may have been affected economically by COVID, and they were working harder. And you can imagine that's a very easy recipe for burnout. And then microaggressions and racism in the work environment also made the list of some of the causes that Black mental health professionals wanted to leave the field. And then also mental health challenges played a role as well. There's a concept called moral injury, which some of you may have heard of. It's defined as when one feels that they have violated their conscience or moral compass, when they take part in, witness, or fail to prevent an act that disobeys their own moral values or personal principles. And it's often associated with some of the high demands in the healthcare setting that result in healthcare workers having to deliver care in a manner that conflicts with their values and their own personal ethics. And imagine having to watch while some injustice or disparity plays out along the lines of race. I myself have seen this with my own eyes during my time working in a healthcare setting. This is a salient factor in workplace stress and burnout. And, just how does racism show up in the workplace? There are probably more examples than this, but lack of inclusion, tokenism, where, let's say there's one person of color in a certain workplace or unit or department, and that person is kind of held out as window dressing to sort of cover the diversity of that particular area. Racial microaggressions, which can show up as insults and humiliations and invalidations that may occur in everyday life. But they do pile up and they can become overwhelming over time. Being verbally mistreated, physically intimidated, or abuse, and also the minority tax, in which people of color may be called upon to represent their race or their ethnic or cultural group, and they end up having to do this representation as an obligation over and above what their basic job responsibilities are. And this can be quite taxing and take people away from their primary work responsibilities. And so it's sort of a catch-22, because the person of color may naturally feel the need or a sense of obligation to be a representative, but this can really pile up and become problematic. I'd like to share with you two case vignettes. One, a Black physician who accompanied a Black male patient who had a mental health condition to the emergency department. The patient was having some difficulties and deteriorating. And when the patient began to exhibit aggressive behavior, the emergency department called the police. And the patient would not respond to the police commands and ended up being arrested, even though that person was at a hospital for the purpose of getting mental health care. And when the Black physician complained to the emergency department about the patient being inappropriately arrested, their defense was that they thought that the Black psychiatrist was a family member of the patient, just made that assumption because they were both of the same racial group. The Black physician was not wearing a white coat, but did wear her ID badge. So that was an unfortunate circumstance where race played a role, sadly, and the shunting of and the criminalization of people with mental illness is a known issue and was highlighted in this very sad example. Another example is of a health professional of color who pointed out some concerns about racial disparities in the quality of care that patients were receiving in a clinical setting. The supervisor of the health professional of color chastised that action and placed for placing concerns in writing about the disparate care. And that same health professional ended up being harassed and investigated, which ultimately led to that clinician leaving the healthcare facility. And so that's also a very unfortunate circumstance when really kind of experiencing a sense of moral injury, seeing that there were racial disparities in treatment, pointing that out and actually giving the healthcare facility an opportunity to rectify the disparity. Instead, there was punishment and retribution. So there may be other examples like this that members of the audience have, which I would love to hear about. But I also wanted to underscore the impact of racism in nursing. And there was a recent survey that found that nearly half of nurses surveyed reported racism in the nursing profession, being called the N-word by patients and being referred to in derogatory ways by managers. And of the 63% who personally experienced an act of racism in the workplace, 66% said it was by a peer, 63% said it was from a patient, and 60% experienced this from a manager or a supervisor. And 57% have challenged racism in the healthcare setting, with more than half stating that it resulted in no change, nothing was done about it. And so, the takeaway message really is that if you speak out, that could potentially have negative consequences and blowback in the form of being ostracized and not being able to advance in one's career. And over half of nurses said that racism in the workplace negatively affected their personal well-being, causing stress, anxiety, and depression. The National Commission to Address Racism in Nursing, which issued that survey, came up with this new definition of racism, which I thought is really striking. Assaults on the human spirit in the form of actions, biases, prejudices, and an ideology of superiority based on race that persistently cause moral suffering and physical harm of individuals and perpetuate systemic injustices and inequities. That's a really strong definition, tapping into really some unique areas that have not been brought out by other definitions that I've seen. Implicit bias, also known as unconscious bias. This is something that occurs automatically in some people and unintentionally. And even though it's unintentional, it still can have a negative impact. This can come in the form of the sorts of judgments and decisions and behaviors that people can exhibit. And this can get in the way of a workplace being able to recruit and retain a diverse workforce. Implicit bias has been shown to contribute to healthcare disparities as well. But the good news is that there are strategies to remedy the negative impact of implicit bias. And some of the examples of this are stereotype replacement, in which we would strive to replace the stereotypes that we hold with non-stereotypic responses, through awareness. Also, to work to identify what are some of the factors that are behind those stereotypes and replace them with a more appropriate view of individuals of that particular background. Another strategy is to use counter stereotypic imaging, which involves thinking about people who don't conform to the stereotype that you hold. There are probably exceptions, but it's very important to be conscious of one's implicit bias, to make that plain and clear in order to begin working on it. And finally, individuation, in which we teach ourselves to avoid generalizations, using generalizations to inform our judgments about people, and also meeting with people deliberately who are different from us, that maybe we might be prone to be biased about. And so there is hope. And actually, I just renewed my medical license in the state of Maryland, and a requirement before I could renew my license, and for all new licensees applying, they had to take a course on implicit bias. So this is becoming mandatory. And at least the state of Maryland is getting very serious about this issue, because clearly they are aware of the potential impact that it can have on healthcare. And even the Joint Commission, I think many of you are familiar with the Joint Commission. I know when I was working in a healthcare facility, we would always be very nervous when the Joint Commission was coming around to assess and evaluate, to what extent were we living up to certain quality standards. The Joint Commission has new requirements to reduce healthcare disparities, which are really all around us, for people of historically marginalized groups. And they're guided by 6 new elements of performance, including designating individuals to lead activities to reduce patient healthcare disparities, actually hiring people to do this, having a role for this purpose, assessing patient health-related social needs to include in the patient assessment so that we understand what sort of conditions are our patients living in that may indeed have an impact on their health. Identifying healthcare disparities in quality and safety in the patient population, developing written action plans to address at least one healthcare disparity. So we should be conscious of gathering the data so that we can identify healthcare disparities and work to change them. And then, of course, taking action if the goals are not achieved to reduce those disparities, and informing key stakeholders at least annually, such as advisory boards and so forth, or community advisors about the progress in reducing healthcare disparities. So we're being held to some new standards now, and there's no getting around this. Again, I'd like to refer to my colleague, Dr. Kamara Phyllis-Jones, and her wisdom about anti-racism in the workplace. And there are 3 tasks that she recommends. Number 1 is to name racism. Number 2 is to ask ourselves the question, how is racism operating here? And really seek to find the answers to that question. And then finally, organize and strategize to act. And so, hopefully people can come together to take on this task. And it's important to act because here's another impactful quote from Dr. Kamara Phyllis-Jones, which I love, which says, "Inaction in the face of need is the hallmark of structural inequity." And so if we see racism playing out in the healthcare setting, we cannot afford to just look the other way. We must do something. We must find a way, and let us not contribute any further to the structural inequities that exist in our communities. There are some examples of different groups that have taken action on racism in healthcare settings. One that I like to point out came from medical students with White Coats for Black Lives, and they've developed a racial justice report card where they look at issues such as anti-racist training, discrimination reporting, protection of marginalized patients and immigrants, looking at staff compensation and insurance. And by bringing up these issues and by actually, grading different academic medical centers and medical schools, the report card has helped students to generate conversations at their institutions about these critical issues. The American Association of Community Psychiatry, which is an organization that I belong to, developed a self-assessment for modification of anti-racism, and it's a tool called SMART, which was developed after the death of George Floyd and many others in the middle of a pandemic in 2020. And it was intended for organizations to use, organizations that are interested in driving anti-racism work, self-directed and sustained. And what's interesting is that for those organizations that would like to use this tool, which they can access online, they actually have office hours for that are led by consultants from the AACP to help people in implementing this tool and using it to improve their footprint as it relates to anti-racism. I also wanted to underscore an initiative by the University of California, San Francisco, a program called COPE, which was established during the COVID-19 pandemic to apply a well-being response to what their healthcare workers were going through. This was something that the Department of Psychiatry was involved in, and it emphasized resilience and stress reduction training, peer support, and really normalizing mental health support to reduce some of that stigma that typically surrounds seeking help for mental health concerns. But one thing that was very unique about this particular initiative that UCSF developed is that it addressed some of the contextual factors that were occurring at that time, such as anti-Black and anti-Asian racism, the impact of climate change, and the political unrest related to the November 2020 election. So they did not avoid dealing with some of these hot button issues that were happening simultaneously with COVID-19. And one of the valuable aspects of this initiative was that it created space for support and productive dialogue. You know, people talk about courageous conversations about the ongoing impact of racism within the medical center. And they launched a series called Bold Conversations for Healing and Reshaping Our Medical Center Community. And I really like even the naming of that because it's very positive and it's focused on what do we want? What do we want to see? And not just anti-racism, but what do we want? What are we moving towards? Here's a controversial issue that I came across. One of my colleagues in psychiatry, Dr. Amanda Calhoun, has proposed the use of body cameras in the healthcare setting so that if there are actions involving racist behavior in the healthcare workplace, that they could be captured. Now, you know, this maybe sounds very extreme and maybe very infeasible in the healthcare workplace, especially given the fact that research has shown, even with the use of body cameras among law enforcement, that it does not necessarily achieve the desired outcomes. And I think we can think of many examples of that, sadly. But, you know, just interesting rhetorical question. What is the feasibility of using body cameras on healthcare workers to track their interactions with people receiving services in the healthcare setting? And, you know, very often we hear this statement, you know, if it was not documented, it did not happen. So many things in our society that we would not know about if someone didn't videotape it, including the George Floyd killing, just as an example. But, you know, I just ask now, if racial mistreatment is not witnessed and recorded, did it not happen? I think we know that these things are happening every single day. And so we really need to find ways of exposing these issues and holding people accountable for their negative behavior, in hopes that we could really eliminate and eradicate racism in the healthcare setting. Well, you know, addressing racism and racial trauma, there are a number of resources out there. The community healing networks, emotional emancipation circles have been used after numerous racist incidents and have been very supportive to people who have experienced that type of trauma. The Four Bodies is a resource online that helps people understand that racism can affect the physical body, the spiritual body, the psychological body, and so forth, and helping us understand those different aspects. The Racial Trauma is Real Toolkit provides some steps that people can undertake if they themselves have experienced a racial encounter, a severe microaggression or other discriminatory event, and provide some tips on what people can do to process that and get beyond it and heal. BIPOC SHIP, which stands for Support, Heal, Inspire, and Plan, works to dismantle some of the barriers to equity. And the BIPOC stands for Black, Indigenous, People of Color Accountability Hub. And it's something that people could join to work with others across race to come up with strategies for moving and advancing towards equity. Undoing Racism, the People's Institute for Survival and Beyond, has been around for 40 plus years, and they do fantastic trainings around the country for different organizations that really want to dismantle racism in their particular workspace. And a new addition to some of the resources is the Racial Equity Support Line, which is operated by Lines of Life. This is a group based in Portland, Oregon, and it's only available in Portland, Oregon at this time, but I have really encouraged the organizers to expand this resource beyond Portland, so that you could call up if you had a question or a concern about an experience of racism that you have dealt with. They provide helpful tips, and the peers that answer the line themselves have gone through experiences of racism and are able to speak from experience about that. And finally, implicit bias training, which there's so many different ones available online, and I encourage you. I was very enlightened by the mandated training that I took in order to get my license, but it was very helpful. And it goes without saying that an aspect of prevention for ourselves is for us to take care of ourselves to the extent possible. And I'm not saying that self-care alone can help us deal with experiences of racism that may occur in the healthcare workplace, but having or engaging in self-care can give us a good baseline so that we, have the energy and the fortitude to deal with these racist events when they occur. Nutrition, physical exercise, relaxation and rest, yoga, mindfulness, meditation, breathing exercises, visualization techniques, social connection, which is so critical, taking walks in nature, journaling, and limit toxic media exposure, which can sometimes really make things more difficult for us and more stressful. And so I'd like to leave you with these takeaways that racism is real and has a negative impact on mental health and well-being. It can also contribute to burnout and moral injury in the healthcare workplace. Racism in the healthcare setting can lead to attrition in a field which already lacks sufficient diversity. So let's not disable ourselves and our workplaces further by engaging in this destructive behavior. Undertaking anti-racism initiatives in your workplace will make it a better place for everyone. And that's really the goal, not to single any certain group out. And then utilizing resources to address racism and racial trauma are very good things to do. It's good that we have these tools and resources available. And so with that, I will stop, but we have a poll question a post question to revisit, and would love to see your responses. So it sounds like it's pretty much unanimous on racism having a negative impact on mental health. And So now with that, thank you all for your participation. We'll go ahead to any questions you might have. I appreciate your attention and look forward to discussion. Thank you.
Yes, thank you, Dr. Primm. Really for placing racism a part of the equation and highlighting how it impacts mental health and well-being. Please feel free to leave any questions in the chat or also raise your hand so we know to call on you for any questions verbally. We do have one comment from India. Awesome presentation, Dr. Primm, which I think we can all echo.
Thank you, India. That's my lovely daughter.
Oh.
There was a pre-training survey, and as we wait for questions to come in, let's see. So there was one question: if there are specific learning objectives you hope to achieve. One was I hope to learn how to protect my mental health while working with marginalized communities in a capitalist system that wants to destroy us all. And then also interested in this topic related to patient dissatisfaction with care. And actually that last point about patient dissatisfaction with care reminds me of that proposal about, having body cameras. And, I think that might be a high bar to achieve at this point. But I think that when we witness something happening that is inappropriate, there are many workplaces, healthcare workplaces included, have different trainings that are required that mandate that if a healthcare employee sees something going on that is inappropriate, that they're supposed to report it. And if they don't report it, it's almost like they're just as responsible as the person who actually, committed the infraction. And so, and then if the manager or whoever retaliates, then that's a problem too. I guess there are different laws in different states and jurisdictions about that. And maybe it's important for us all to be cognizant of our workplace policies, as well as the laws in the places where we live, so that we know, what sort of rules would govern our reporting of abuses. And so, and that really also gets to the moral injury piece of watching things that are egregious and not saying anything. And that really does wear on us and, can certainly contribute to burnout. And actually with an answer to the question, what are the biggest challenges you face related to this topic? People mentioned time, moral injury, determining fact from fiction, and mentioning that being a minority is enough stress. So let's see if any other comments have come up. I know this may be kind of a challenging topic for many to speak out on. But I think it's a reality that we all need to face, and recognizing that at this time in different states around the country, there have even been prohibitions in funding diversity, equity, and inclusion initiatives or talking about structural inequities. And so I do recognize the challenge that our current environment places before us as it relates to these issues. So I will say I'm thankful that Healthcare Ready, provided this platform to share. And for those who were not able to attend today, the recording hopefully will be available. So I see a question, any suggestions on how to address racism in our institutions if we are fearful of retaliation? I'm thinking one way, is there a way to submit a complaint to one's healthcare facility anonymously? There are some workplaces that have like anonymous idea boxes and stuff like that. I don't know if you all have heard of that. But if there was a way to provide an anonymous complaint, I mean, that would be one way. I'm trying to think of others, but I think that's a good question. Retaliation is real, but I think if you can prove that, in many places it's against the law. And so from a legal standpoint, you would have favor in that regard. But I understand people who might not want to take that risk. It's a really difficult decision to make. And I mean, sometimes if things are really that bad in a given workplace, people might elect to leave the workplace and work elsewhere in a setting that is more conducive to a more fair and equitable environment, because some of us may just not want to be a party to egregious racism. And in actuality, I think many of us are socialized and raised to tolerate difficult situations because we want to keep our job. But I've learned from mentors that that's not always the right thing to do, because racism and other similar stressors can have an impact on our mental health and our physical health. And so at some point, we have to draw the line and remove ourselves from toxic situations that are, doing damage to our health and well-being. And so that is really a part of our responsibility for self-preservation. And working in toxic settings, can be rather dangerous to our health. So we really have to make some tough decisions when we're faced with these sorts of situations. But hopefully human resources often will provide training that relates to diversity, equity, inclusion, accessibility, et cetera. And using the rules and the policies and practices of the institution as backing for whatever action you're taking or complaint that you're making, so that you're working within the structure of the institution, and really holding the institution accountable for what it says its mission is, and what rights and responsibilities are of patients. There's usually a patient bill of rights of how they're supposed to be treated. And it looks like maybe, with the Joint Commission coming around and tracking certain indices and, that list of essential elements that they are now looking at, healthcare institutions will recognize that there may be some risks for them not addressing these issues in the workplace. So perhaps things are changing for the better as it relates to racism in the workplace. I'm going to choose to be hopeful.
Thank you so much, Dr. Primm. Thank you to everyone who's joined the event today. Alyssa, any final words that you wanted to mention?
Yes, thank you, Angie, and thank you, Dr. Primm, for incredible points on how racism contributes to burnout and how we can respond to racism in healthcare settings. On behalf of Healthcare Ready and All Healers Mental Health Alliance, thank you all very much for attending. Please complete the post-event survey. We have dropped the link in the chat. Your feedback will help us inform the success of this program, and it is completely confidential and anonymous. As Dr. Primm mentioned, we'll be sharing the